Hi everyone, welcome back to our ABN booth at the KT Canada Scientific Meeting. I am so excited to be interviewing Cheryl Koehn, who is the founder and president of Arthritis Consumer Experts. Cheryl is my friend, my mentor, and my boss, so let's hope I ask the right questions.
Yeah, no kidding. No kidding. The pressure's all on you.
I know. So can you tell us a bit about yourself and how you are involved in knowledge translation?
Sure. Great to be here. Thank you for inviting me, Maya. And Anita Chan, our fearless producer. So as you know, Maya, I've had rheumatoid arthritis for 30 years. And it was not long after my diagnosis I learned that there wasn't a lot of information out there for me. And I looked around and I didn't see an organization that kind of looked back at me, that looked, acted, smelled, walked, like me.
Yeah.
Which was really the motivation to found Arthritis Consumer Experts, but more importantly, to actually develop tools organizationally to shape information from science and put it out to patients and public to help them.
Yeah.
Which is at its very core what KT or knowledge translation is. It's about mobilizing knowledge and getting it to people so that they can then take action. So that's really, I've been volunteering and working in the health community, health educator community for, I guess, almost 30 years, and the last 20 leading and following my team members at Arthritis Consumer Experts. So it's been a really cool journey. I think we've done lots of innovation, mobile apps, Arthritis Broadcast Network, our joint health education online programming, which graduates patients to have the power to have a better conversation with their clinician. Like all of these cool things we've done over the years. And based on what our membership and followership of 40,000 across the country has told us they need. So, in a nutshell, that's sort of where I come from, how I got to where I am today in this chair sitting across from you.
And it's very interesting because the work that you've been doing for 20 years, you said maybe even some time before that, is really knowledge translation. Although, correct me if I'm wrong, it was done at a time when knowledge translation, it didn't have the vocabulary around it.
Absolutely. And not only that, I guess an extension to it and a connector to this conference is patient engagement in the knowledge translation process. So it used to be that it wasn't even called knowledge translation. It was basically trying to get clinical guidelines followed by clinicians.
Yeah.
But that's where it ended.
Yeah.
It didn't reach beyond the clinical office. And the knowledge translation, or as I call it, getting, Greek to street. Yeah. None of that had a mechanism. There was no framework, and that's really what we've been talking about here in this Greek to street event. From all the KT experts that have come and been in our interviewee chair rather, we've learned that there's now a cool science behind it. But when we started, it didn't involve patients. And so we were kind of an outlier and I'm comfortable being that, right? I guess we all are as patients, because when we're diagnosed, we're an outlier from the beginning. That's how we feel inside. You feel alone and isolated. So organizationally, that's kind of how we felt.
Yeah.
But then as we deepened our own knowledge, obviously it was a huge learning curve for us about how do you develop communication platforms and tools that effectively and responsibly and ethically get information out. We learned that from our colleagues in research, and we are so indebted to them. Like I say 1,000 prayers to them every night before I go to bed, because without their partnership and even beyond that, without their trust, we wouldn't be doing events like this.
Yeah.
And you've heard it yourself from people coming into the interview booth, how pleased they are to be here, because even though we've been doing this for 4 or 5 years, it's fresh to them, and they can see the potential of having power in the hands of patients to shape KT products, if you will, the way they see them. And I'm going to talk about that a little bit on this afternoon's panel, about who has the power and how does the power get used in the ways that we think it should be used.
Exactly. So can you tell us a bit about the panel discussion that we'll be speaking at this afternoon?
Sure. So there's two panels. One before ours, part one as they call it, is talking about the measuring patient engagement.
Okay.
Not just in knowledge translation, but in research in general.
Yeah.
And our panel is sort of a continuation of that. Dr. Deborah Marshall and Dr. Koehn Hamilton, both of who we've interviewed, I think at this point, will be joining me, and I'm the sort of the wrap-up. I'm the clean-up hitter, as they say in baseball, for the day, basically sharing my own more personal views on what I've seen over the years in patient engagement. So our panel is really talking about a couple of models. One that is the core of Koehn Hamilton's research, and one that has been really, I think the brainchild in large measure was Deborah Marshall around the PACER program. And that's actually patients who actually do the research. So they're trained to be researchers. So it's kind of taking patient engagement to the next level or another level. I don't want to say next level because it suggests that it's a better level than someone like maybe you or me who wants to participate as a subject in research. Maybe someone who wants to inform the design of the study or the research process or monitoring the safety of patients, for example. In a clinical trial, that's patient engagement. So patient engagement comes in so many different shapes and sizes and colors. So that's where there's some tension. I probably, in my remarks, I'm predicting to my colleagues on this afternoon's panel because I'm not sure you can measure it all. I'm not sure you want to measure it all.
Interesting. So I do know that there's different perspectives when it comes to evaluating patient engagement. So if you feel comfortable sort of speaking about that, I'd be interested from your patient perspective.
Yeah, sure. So my questions to researchers in measuring patient engagement are one, who has the power to decide what gets measured? And are patients engaged in the process?
Interesting.
Either on a project-by-project basis, or on a system level, on an organizational level, at a funder level, who gets to decide? And do patients really enjoy the same power of decision-making in choosing the measures? Is it only patients and their engagement that gets measured? Or are we going to measure researchers
who are working with the patients
who are trying to engage? Are they doing a good job? I have never seen a scale measuring reserchers.
That's a very good point.
So
it's very interesting.
So I just kind of, when you pick up a dice, there's, all those different sides of the dice, and it's important to look at each side to know what number's on it.
Yeah.
And I guess, to me, I'd like us to roll the measurement dice around so that we're not just focusing on one side.
Of course.
With one set of numbers on it.
Yeah.
And that's not only true, my belief of that is not only true for measuring, sort of the research engagement, researcher engagement, but institutional, governmental, societal. Like, we should be looking at measuring a lot of other things, not just the patient, because as you well know, we get measured a lot with our disease. People are constantly evaluating us. And we're doing that same evaluation ourselves through our self-care process.
Yeah.
So I think, while I think focusing on the patient is fabulous, and we've seen so many positive improvements in healthcare, in research, in self-care, in funding because of patient engagement efforts. But I think we need to look at the full picture. Yeah. That's basically my take-home message this afternoon. And I hope it will stimulate some dialogue that perhaps hasn't yet taken place.
Because I mean, that's ultimately what knowledge translation and patient engagement is all about, is looking at things from different perspectives.
Yeah.
And considering different stakeholders and their needs and their opinions.
For sure, yeah.
So I think you're in a very unique position because you have been working in the field of KT for quite some time.
Yeah.
And you've seen the advancements, and now you're leading a program that is doing a very direct version of KT to patients. And how does that feel to sort of witness that process?
It's interesting. It makes you feel old, especially when you're being interviewed by you. But old in a good way. I've seen there are certainly many benefits to experience, good and bad. We've learned we've not done everything perfectly, for sure. But I think when we've not done things perfectly or well, we've done everything we can to improve and to change that outcome, which is really why you measure, actually. You measure in order to benchmark your performance and to do better, to get better, with the end objective being to make it better for patients out on the street.
Yeah.
To make the person who doesn't get invited into a process, who doesn't get to sit on a research team, who isn't getting their appointment as quickly as they can. Do you know what I mean? Like,
that's the ultimate goal.
For sure. So that's what I've seen over the years is certainly tons of improvement and a growing willingness to give us patients power to be a meaningful player, if you will, or participant, not just in our own care, but in research as well at funding levels. And I think, lastly, Maya, I've seen the tension that has built as knowledge translation science and implementation of that science has grown. I've seen the community come to us or suggest to us, well, you're not getting that right. So it's someone external maybe suggesting, oh, this should be maybe tweaked to this way.
Okay.
And you have to be, you can't be too sensitive. You have to take that away and go, okay, well, those are experts making these suggestions. Yeah. So we better listen to that. But then we never want to lose the magic. And that we know from our membership and followership is the most important thing to us, is that we bring, because of the way we operate, how we're constituted, how we're governed, we bring a magic, I think, to the process that should remain magical.
Yeah.
That doesn't sound too corny.
No, not at all. I agree, and I think that's an important
So there's an organic nature to what we do in some ways, which I think we want to maintain.
A human part of it.
For sure.
Yeah.
And I think, with that comes failure once in a while. You just have to be brave. Because you don't win without bravery, and you don't survive loss or lack of success without bravery. So I think a big part of what we do is kind of bravery.
I agree. I think that's a very important message.
Yeah.
Well, Cheryl, thank you so much for talking with me today. And I hope that the panel discussion today brings up all of the questions and the discussions and the points that you... I'm
sure it will. My fellow panelists are so skilled and expert, and I'm really looking forward to it. Thank you for having me, Maya.
Our pleasure.
Yeah.